bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, the McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, and the Holland Bloorview Children's Rehabilitation Hospital Foundation. We would also like to thank the following Keystone partners for their ongoing contributions that support all of CAFC's programs and activities.
Hello everyone, and welcome to today's episode of CAFC Presents. My name is Doug Maynard and I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. Today's webinar is titled Using Technology to Transform Care, Engaging and Activating Families in the Implementation of a Health Portal. We're very excited to bring our colleagues from the Holland Bloorview Kids Rehabilitation Hospital today to present on their very interesting program. This session actually came to us following a presentation on another electronic patient portal that we've had a presentation on about, I think it must have been about 3 months ago, and that project was from our colleagues at CHEO and their project called MyChart at CHEO. So this was a really interesting opportunity to present another similar but different project, and one that comes to us from the rehab context, or the context of a rehabilitation hospital. And we're also going to hear a bit more about their implementation process and how they engaged patients and families in their implementation of this electronic patient portal. So it's going to be, I'm sure, very, very interesting today. And before we introduce our panel, just one other announcement. I'd like to mention the 2015 CAFC Annual Conference, which is coming up on October 18th to the 20th. In Quebec City. Everyone is invited to join us in Quebec City, where we'll learn and share our expertise in finding solutions in children's healthcare. There will be a rehab symposium on Sunday, October 18th, where our colleagues from CINSER, the Canadian Network of Child and Youth Rehab, will be leading us in a half-day session. We'll also be hearing from the colleagues at the Canadian Family Advisory Network, who will be partnering for an afternoon session with our rehab colleagues at CINSER. So lots of great stuff coming up at the conference. So if you do need more information about the conference, you can always go to www.conference.cafc.org to find more information. All right, so it's now my pleasure to introduce our panel. Today we have 3 colleagues joining us from the Holland Bloorview Kids Rehabilitation Hospital. First we have Laura Williams, who is the Director of Client and Family Integrated Care at Holland Bloorview. Laura has worked extensively in the field of healthcare in adult and pediatric settings in both frontline and leadership roles. And Laura is also the co-chair of the Canadian Family Advisory Network and coordinates that annual symposium that I was just talking about on family-centered care. Joining her is Joanne Maxwell, who's a project manager in clinical adoption at Holland Bloorview. Joanne has held a number of operations and project management leadership positions in healthcare. In her current role, she leads the activities related to improvement and enhancement of the electronic health record, with a focus on change management and interprofessional collaboration. And joining them is Amir Karmali. Amir is a family integrated care specialist at Holland Bloorview and plays a key role with their family leadership program in their client and family integrated care program. So it's my pleasure to hand the virtual podium over to our colleagues at Holland Bloorview. Over to you guys.
Okay, thank you very much, Doug. Good morning, everyone. On behalf of myself and my colleagues, Laura and Amir, we would like to thank you all for attending today's session. We would also like to thank CAFC for this opportunity to speak to you about our experience in launching our Connected Care portal. And we'd certainly like to invite you to ask questions and use the chat box as we go through the presentation, and hopefully we'll have lots of time at the end to have a bit of a discussion.
So it's Amir Karmali, excited to be here. Thank you for having us. Let's get to know who's joining us today and see if we can learn from each other. So the poll question comes up, and who is joining us today?
Yeah, so we're going to be having a few poll questions today for anyone who's participated in our webinars before. This will be familiar. Just go up and click on the screen and make your choice, and let us know what your primary role is. We know many of you have multiple roles from this list, so frontline clinicians, healthcare administration, family caregiver, patient, or other. And if you come from that other, feel free to type in the question box. Just let us know what that other might be, just to give us a sense, because as I can see that other is quite large. So just type in into the question box and let us know what that other is. So we can see 50% of you are healthcare administrators, 18% are frontline clinicians, and the 32% are in that other category.
Oh, interesting. Okay. Poll question number 2. So we have a nice variety. So poll question number 2 is, does your organization have a consumer health portal? Yes. Soon. We're kind of working on it now. Or no, not yet.
All right. Well, we've got a... Oh, we finally had a yes. There was no yeses for a while. 5% have said yes. They do have a consumer health portal. 67%, fortunately, at least are working on it, and 29% have said no, not yet.
Sorry, there was 16% that were working on it?
67.
67 are working on it.
That's
excellent. Great. So that's really good news, because we've seen a lot of success on our end for the portal, and we've heard from our families, and we'll share with you some of the things that we've heard of what this has meant to them and how valuable it's become to them. So the last question that we have for you is, what are you most interested in learning about? Are you interested in learning about the features of the portal, how to engage clients and families, uptake and adoption, or all of the above?
So most people, 78%, are interested in everything. But for those of you who are more selective, 13% said the features of the portal, and 9% said how you engaged families and clients in this process.
Excellent. This works out really well, because our presentation will help with that, we hope. You cover all of it.
Okay, so just as a little bit of an introduction, for those who might not be familiar with Holland Bloorview, we are located in Toronto, and we're Canada's largest pediatric rehabilitation teaching hospital. We provide specialized programs for children and youth with rehab and complex care needs, and we often see our clients and families over a number of years for multiple services, which I think really supports the use of a consumer health portal. Every year we see 7,000 children and youth, with close to 600 inpatient admissions and about 58,000 outpatient visits.
Okay, hi everyone, it's Laura Williams, and I'm going to set the stage really for the family engagement, the client engagement, youth and children being involved in the process, not only of joining the portal, but how we made decisions about the portal, even from the decision to do this, to venture down this pathway or not, and what it might look like. We do have a family leadership program at Holland Bloorview. We currently have 160 family, youth, and child leaders who advise on all activities in the hospital. So every project, every working group would have the client and family input. We also have mentors providing peer support through a program called Parent Talk. We have family faculty who teach through grand rounds, new staff orientation, and in our simulation programs. And we also have families fully engaged in all aspects of our research process, from decision-making about projects to co-investigation on research projects. So we're well set up to engage our stakeholders in all aspects of the development and implementation of the Connect to Care project. So this slide just shows you the different ways in which we did engage clients and families. We mentioned that it was integrated throughout the project, and really from the onset of that pre-funding application, we have an electronic health record, and once that was established, we heard from families right away that they wanted the information. Now that it was electronic, how can we access it? How can we see it? How can we use it? And so we brought those families together, even at the pre-funding application stages, to say, if we apply for funding, if we see that there is an opportunity, we've been in discussions with Canada Health Infoway, we knew that they may have funding opportunities. What would be meaningful for you in an online portal? What do you see as the most valuable, so that we can structure our application around that? No point in developing a tool and investing all of this time and energy if it wasn't going to be meaningful, user-friendly, and helpful to the healthcare experience. This is really meant to drive better care and more activation in care for clients and families. And so this chart demonstrates all the ways in which we then from there engage clients and families. And during our presentation, we'll be giving a description of each of these bubbles and how families were engaged in these processes, as well as what happened during each of these stages. And so, of course, we have to answer the question, why even have a portal? I mentioned earlier that families were really keen to have this information early, once we had it electronically available, to promote access to information, to ensure that our documentation met their needs, that they had access to it and could bring it to other appointments, that if they had questions afterwards, that they would be able to access those documents quickly and easily, and that we would be promoting and ensuring further partnerships, that, you know, clients and families can access their records, but previous to this, to do so was onerous. To go to health data records, ask for print-off versions of it, and then it becomes also very cumbersome to have a filing system that would keep this information in a readily accessible and usable way. And as well, promoting that continuity of care between providers, between families and their providers, enhancing communication, and potentially reducing repeat visits through better health care. Better access to information promotes better care and better health outcomes overall, and we know that, and the literature shows us that as well. So now I'm going to turn it over to Joanne, who's going to talk to you about the main features of our portal based on the information that we learned from families.
Okay, so as Laura mentioned, the features of the Connect to Care portal reflect the priorities of our clients and families as identified through our focus groups. The timing of some of the implementation of the features was also influenced by the identified needs that our clients' families spoke about. So the first feature is around clinical documentation. So Connect to Care offers clients and families the ability to view parts of the health record. Our initial launch began with the sharing of sort of formal reports, dictated notes, many of our physician consult notes, but we are also slowly adding more clinical documentation to Connect to Care from all of our health disciplines. And users can also see lab and microbiology results and x-ray results that were originated here at Holland Bloorview. The second feature is the ability to view upcoming appointments and their visit history. And initially we thought that the scheduling functionality would come later in our implementation. It was a little bit more complex to put it into action, but with the feedback from families being so strongly in support of being able to access this information, we worked really hard as a project team and with our information systems team to be able to have view access to appointments available in our initial launch in December. We're also now working on some additional functionality that allows people to cancel and request appointments through Connect to Care. We're in the early days right now, but we'll have 3 appointments available by next week, and we'll slowly add more appointment types over the fall. The third key feature is the ability to securely message members of the healthcare team through the Connect to Care portal. And this is a key feature because many of our clients and families often ask us if they could use email instead of having us call them. But security concerns and college requirements for many of our professional groups make this very challenging. So two-way messaging through Connect to Care is a secure solution that offers this flexible and more, for families, a more convenient way of contacting us. So again, we started we went live with this functionality in May of this year with just a small group of clinicians, including 2 of our physicians. And we've been slowly adding additional clinicians over the last months. So as of this morning, we had over 60 clinicians set up to use two-way messaging. So far, our message volumes are quite low, but that's because we haven't done a lot of communications to our enrolled users yet to tell them about it. So as we start to get that communication out and we start to work with our clinicians around how to use two-way messaging to support clinical care, I think we'll really see some increased volume in this area. And I think we'll hear a little bit later when Amir talks about some of the feedback from families how important this is. So that tells you a little bit about the main features of Connect to Care, and at the end of our slide presentation, we'll actually do a demonstration so you can see what it looks like in real life. So this next slide shows our project governance structure. Our project team included staff from health data records, appointment services, information systems, collaborative practice, client family integrated care, communications, privacy, and other members of the hospital as we needed. So as you can see, we also had Canada Health Infoway as partners at both our steering committee and our project team level. And I should have mentioned in the very first slide that we should also acknowledge that Canada Health Infoway has been a really important partner in this project and is supporting us financially with our portal demonstration. And they've been really involved, not just as a funder, but as a key partner throughout our implementation. So if there's one thing really that we want to highlight with this slide is that it takes a lot of support across the organization to move a project like this forward. We had a fairly tight timeline, and it really needs support at all levels of the organization to move it forward.
We've had, and from a family engagement perspective, we have 2 families on the project team, 3 families on the change team, and 2 families on the steering committee. And this has been critical to the project, as we all know how projects move and change and directions of the project change. So we're able to have the family's voice at the table right at the project team level. At the change team level, we've had some really deep discussions with our physicians and our clinicians about there's some nervousness from them around families having that much access to the reports, and families were able to be at the table and share with them why it was important to have access to these reports. So for example, in one of our meetings that we were there, one of the clinicians was saying, well, I don't want families to take things out of context. And it was really amazing to watch the family on the other end say, well, I am the context. So we will not take anything out of context. And then there's another example of a clinician saying, well, where we may be thinking of this diagnosis, we're not sure, but we have to run a few more tests. And now the family might get really nervous or scared about this potential diagnosis. And the family responded by saying, I'd like to know, and I'd also be a great partner for you. Once you tell me that this might be something you're investigating, I'll do everything I can to help you out. So those discussions have really led to bringing some of that fear down at that level. And then having families on the steering committee has been really helpful for us as well too, because this is an opportunity for the senior management team to really hear from families how some of the decisions made at that level will impact the families. And that typically doesn't happen at the steering committee level, to actually hear from the families about those decisions and how it's going to impact them. So some wonderful discussions and some wonderful opportunities to co-design this portal.
It's Laura. I'm just going to add too, at the steering committee level, one of the parents is actually an IS and IT expert.
Yeah.
And so he's there bringing both his parental hat, his experience hat, as well as his unbelievable breadth of knowledge in the realm of technology. So he's very understanding about the limitations, but then also is able to help us kind of push ourselves further in thinking through some of these limitations.
Yeah, and on our change team, we actually have a mom who's a physician, a family physician as well too, and so she's bringing in both perspectives. She understands some of the fear around being that transparent, but also is able to share with her colleagues why, from a family perspective, she needs it. So some wonderful discussions have happened at all those levels.
Okay, so next we're just going to talk a little bit about vendor review and selection. So obviously selecting the actual solution was a critical step in our journey, and clients and families played a key role in this activity. We had family representatives on our working group that identified the requirements and put together the request for proposals. And as well, they were on the proposal review team, so actually reviewing the responses to our RFP. I think that a lot of organizations might be hesitant to include families in this way for fear that they may want, sort of the best of the best, all the bells and whistles, or they might not be as concerned with costs as the organization might be. But in fact, our families were concerned pretty much about the same things that the organization would care about. And they brought in a really important lens with respect to the most important features from their perspectives. For our clients and families, it was really important that the product we chose would be simple and easy to use, and that it would keep their child's information safe and secure. Although I would have to say that the privacy and security was probably a bigger concern organizationally than it was from our clients and families. For families, they also they wanted to make sure that the organization was making best use of our healthcare funds. So, their preference obviously is that we invest most of the funding into care. So they wanted us to come up with a solution that was cost effective, provided what we needed, but wasn't going to be overwhelming in terms of cost. Because our timelines were very tight, choosing a vendor who could integrate with our existing health information system was an important consideration. An integrated solution allowed us to move forward really quickly and be confident around privacy and security. It also allows us to store all the data in-house. Obviously, the functionality and features were very important, and it was important for us to schedule access and ability to securely message through the portal. So in the end, our Connect to Care portal is the Meditech patient portal, which integrates with our existing health information system, and it allowed us to really move very quickly from actual purchase of the solution to implementation, and it really supported what the families wanted in terms of simplicity, features, and security.
So we decided to do our soft launch with the Family Advisory Committee because the Family Advisory Committee is a very engaged group in the Family Leadership Program. They were also part of our pre-funding application conversations as well as our focus group. So it was a natural choice to go with the Family Advisory Committee. We knew they were going to jump onto this portal, start using it, and give us real honest feedback on what needs to be done before we actually go live. So the picture that you see here is actually, we were all set on December, for our December FAC meeting to enroll 25 families. And we had planned everything and we were ready for everything, but what we weren't ready for was a snowstorm. And it's probably the first time that the meeting got canceled in the 3.5 years that I've been here. The FAC meeting got canceled, and so we had no families to enroll. However, it was probably a good thing for us because we did manage to enroll 7 people throughout the day. We knew some families were inside the building from the Family Advisory Committee, and we enrolled them, and we realized it took us a lot longer to enroll these 7 than we first anticipated. So maybe the 25 that we were hoping for may have been overwhelmed. Either way, we hit our target of the first user on by December of 2014. We did a 2-week pilot with this group, and we managed to enroll a few more of the Family Advisory Committee members. And they were really important in terms of getting things tweaked before we start to go live. They gave us a lot of feedback. There was a lot of learning from them. And some of the learnings were around technical issues. We had sporadic internet issues. We were using iPads to finish profile setups, and they weren't functioning properly. So it gave us an opportunity to really try it out with people we knew would not be getting too upset with us. And then we learned a little bit about our enrollment process and the forms we were using. We were able to tweak some of those forms and clean up the process a little bit. And obviously, as we started to practice with them, we got quicker with the enrollment. For example, some of our consent-only forms, we didn't actually have one that allowed a child to give consent but not actually be part of the portal itself. And it just allowed us to really clean up our processes before we went live. So part of our enrollment plan, and this has been a real success, we had committed to having 700 people on enrolled into the portal by the end of 2015. By July 19th, we were to have 350 people enrolled to the portal. And again, it's been a success for us in terms of enrollment, and it had really to do with the enrollment plan, and that really included having family leaders as enrollment leads, and they were dedicated to ensuring that those numbers were met, as well as the plan included going to where we knew the immediate need was and the impact would be right away, as well as where our champions were and who were going to really uptake this product. So we started, as I mentioned, we started off with a 2-week Family Advisory Committee pilot where we got an opportunity to learn what things could look like and how things would work, and we tweaked it before we went live. We then spent 2 weeks in the inpatient area, and that gave us an opportunity to really get to the people who would use it the most. They have the most appointments, the busiest schedules, and gave us an opportunity to spend some time educating those families, and again gave us another opportunity to learn a bit more about our process. The key thing we did here was we actually offered enrollment on evenings for families who may not be there during the day, as well as the weekends. After that 2 weeks, we did a real soft go live with the Family Leadership Program with our 160 volunteers as well as staff. We didn't advertise it too much, but we did an exclusive registration process for our Family Leadership Program. That gave us that final step of being able to tweak our processes, our forms, before we went live to the outpatients. We then went live to the outpatients, spent a couple of weeks with them, working out through some of those processes, and now we're always live with them. What we've learned from working with our outpatients is that we can't stay in one spot. So we had a table and a desk on the first floor, but we realized that we needed to get out there and really educate the families and let them know about the portal. And we use a trolley with a computer and a printer that goes anywhere. So we know when where the clinics are, when the clinics are busy, and we're up and about, ensuring that we're in those waiting rooms, educating and helping families enroll. And that has been a major success for us as well too. From there, we look for other opportunities for enrollment outside of the weekend, the weekdays, and so we found some in the education workshops. Holland Bloorview holds many education workshops, so we ensured that we were there with our trolley, being accessible to families, giving them an opportunity. If they were not here for an appointment, maybe they were here for a workshop, they could enroll with us. From there, we went to our satellite clinics and towards our nursery schools and trained our staff there to provide a bit more accessibility to families who may not be coming to Holland Bloorview. And then we're looking at our community clients and getting them enrolled, giving opportunities to our clinicians who are working out in the community. We train them on how to enroll families and fill out the forms, and just giving a bit more opportunity to always be accessible. So it's always about going to where we know the people are. So that has led us to, as of yesterday, over 600 users. So as I mentioned, we were to have 350 users by July 19th. We're at just over 600, and our uses are really high. There's 2,800 plus uses, which means that these families are actually getting on and using this portal, looking at their appointments and their health records, and that is a really high number to what we had committed to. So very happy with the success of this portal to this point. Some of the other learnings that we've had from this portal. Enrollment leads. I'm a parent of a client here, as well as my partner, who's Becky Quinlan. She's also a parent of a client here. You see her in the picture. She's one of the enrollment leads, and it was really helpful to have enrollment leads. First of all, just dedicated to enrolling families full time, but to also bring their lived experience. We're able to share how we use the portal with our families, why it's important to us. Families some of them are nervous about, well, this is my last appointment, or this is my first appointment, or I don't really use it much, and we're able to sort of give our experience and say how this would benefit them, and educate them, and use that to build a connection and relationship, because it is conversations that we're having in the waiting rooms. Although it seems a bit of us going around and saying, hey, we have this portal, families have not heard about it, so it's our job to be able to educate them. We also learned our success was to go where the people are. So I mentioned that we go through the different waiting rooms, different education workshops, any opportunities. I mean, we have swimming registrations on the weekends. We were here on the weekends with them. If there's any fairs happening, whether a respite fair on the weekend, we were here on weekends with them. We provided opportunities for weekend clinics, evening times. And then we found out who our partners were and who our champions were, and worked with them. Our clinic coordinators became our partners. They were telling us which families had longer wait times, and we could approach them and talk to them. They were actually starting to help us organize these families who were waiting and saying, well, this family's got about another 10, 15 minutes to go in. Maybe you want to go talk to them. And then the biggest key is to recognize our champions. Once we started recognizing our champions, we really started to see an uptake in the conversation around them sharing with families about the portal. And so it was really important. We recognized anybody and everybody who even said a few words about the portal, and that really started them to talk about it even more. So lots of key learnings throughout this process. So we talked a little about what we've heard and what this really means to our families. And I always say the story is that I joined this project early in 2014, and I knew it was going to be a very cool project. It was going to be something that families needed. But it wasn't until we started to enroll families that it really hit home how important this is going to be, and this is for them. And as I enroll families throughout my days, I continually hear how wonderful this is and how helpful it is. So some of the examples are reviewing my visit history remind me of how much Holland Bloorview has been part of our lives. We're so grateful. That was something interesting to see when people look at their visit history. Some people go back 17, 18 years, and to watch them actually walk this journey, which is something that we didn't anticipate in the enrollment, but has been a wonderful experience to see. The next quote is, "This is amazing. I can show this to my coach, and he can plan my training accordingly." This came from a youth who was a soccer player, was a high-level soccer player, and was in here for therapy. And something I didn't think about, and I'm a soccer coach, and this one really hit me as a soccer coach to say, wow, you know what, the portal can be used in so many ways. So that was just really important for him. I was enrolling a mom, and she pulled out that binder that you see on this picture. And as I was enrolling her, that was her comment to me, "I can't wait to get rid of this binder." And that binder was only for a 6-year-old child. So we can imagine what that would be for a 15-year-old child. And we've talked to some families who said they've dedicated space in a room and a major filing cabinet just for these records. And so now they're able to download these into their computer and create folders as they would with their other documents and print them out if they wanted to. And this is the last one. It's a huge advantage to have all that information at my fingertips as I continue to plan their care. This is from a single mom who has 2 children who are clients here, and she's actually weaning one of her children off some medication, and there's some heavy meds involved, and so she was really nervous about weaning them off, and is using the messaging feature, so when she does start to wean them off, right away she can send an email to her clinician and say, "Here's what I'm noticing," and then the clinician can read it and respond, and they can adjust how they're going to proceed based on what's going on with the medication decreasing. So for her, she's on this all the time. She's on it on the bus. She tells me that she's waiting in line, and something will pop up in her head and remind her. She'll remember something, and then send an email off to her clinician to say, oh yeah, by the way, this also happened, and the clinician can respond accordingly. So we've heard some amazing stories, and it's almost every time that we enroll somebody that we hear an amazing story or another story of how this is so helpful for them.
So just to talk a little bit about the research that we are doing on this project, we thought it would be very important. We're hearing the qualitative feedback, we're hearing the stories. They all, these stories help us feel as though we are on the right track. But of course, having a rigorous research methodology attached to a product like this allows us to then share what we've learned with the system, and of course that's something that we want to do, and Canada Health InfoWay is very interested in doing as well. So right now we are engaging in 2 research projects with the Bloorview Research Institute here, because we did find that there's not a lot in the literature about the impact that consumer health portals can have on engagement in care, or the impact that it has on clinical documentation. Does it change documentation practices? And we thought both of these questions would be very important to find more about. So our first project is looking at the effects of a client and family portal on client satisfaction, engagement in care, and client-provider communication. So it's looking at the 3 areas in our portal that we have available to families, and understanding more about what do those areas do for families, not just from access, but how does it help them be more engaged in the care process? How does it help them have more information so that they can support their children, or so that youth can ultimately be responsible for their own health care as they transition into adulthood? And then how does that 2-way messaging impact client-provider communication? Does it support ease of access? Does it reduce phone calls? Does it reduce visits? These are some of the questions that we're looking to understand. We're also looking to understand the barriers to transparency in clinical documentation. Does it change that conversation at all? And of course, we've been in touch with the colleges, done thorough reviews to support our clinicians in feeling comfortable with this methodology. And really, we know it doesn't change. It shouldn't really change anything, knowing that the health record is the product for the client or the family, but having the ease of access has really changed the discussion. So great opportunity for us to learn here. Joanne, I don't know if you have anything else to add. We're also doing some surveying with Canada Health InfoWay in the fall. I don't know if you want to speak to that for a moment.
So as part of our partnership with Canada Health InfoWay, we'll be doing what's called system and use surveys with our clients and families at 2 different points in time. And that'll give us additional information about the value of connected care to our clients and families, and some more information about the types of the most important features, I think, for clients and families. With respect to the second question around transparency in clinical documentation, this one really came sort of organically out of a lot of the discussions that Amir spoke about earlier at our practice councils and at the change team, where we were really hearing from our clinicians who openly were sharing some of their hesitation around access to information that was much easier and sort of information at their fingertips. And not because they didn't want to share information. It wasn't, they really want to do what's right and best for clients and families, but there's a lot of concerns that were raised with respect to, things like, will people see my spelling errors? When I was taught how to document in a chart, I was really taught more how to share information with other colleagues. So I use a lot of technical terminology and sort of healthcare lingo. How do I now write my notes to support clients and families to be partners in care? There was some of those the hesitation around sharing information that was felt to be sensitive. So we're really working on how best do we support our clinicians and how do we understand some of those barriers, but also some of the positive things too around transparency in clinical documentation. And I think that's something that we maybe didn't expect to come out of our Connect Care implementation, but it is a significant change for our clinicians. Not for all of them. Some of our physicians have said it's really no different because they were dictating their notes before and they were mailing them to families, so they don't really see as dramatic a difference. But for some of our clinicians, they really were feeling that their documentation was sitting in a chart somewhere and rarely accessed. So now it's under a greater spotlight and they want to do the right thing. So it's an interesting challenge that we're looking at.
So I think, again, that's a great point that we didn't expect it to drive practice in the way that it did. There were a lot of iterative learnings along the way, and having the enrollment leads as part of the project team, as part of the change management team, we were able to shift and change as we go. And I think that's a key point, is just having those stakeholders and those who are hearing from families, all the right stakeholders at the table, knowing that it's not a set process, that it's not a set project, but that there is some opportunity for flexibility. Go ahead.
Sorry, I was going to say, from the enrollment lead perspective, we were front line, and so as we were enrolling families, we were hearing we were getting a lot of feedback from families as we did the tour with them and showed them what the portal looked like, and they started using it. We were getting immediate feedback. So I would enroll somebody today, and then 2 weeks later, they've been on the portal 2, 3, 4 times, and then we'll come over and say, this would be really nice, or this would have been really helpful. And we were able to feed that right back to the project team fairly quickly and help everyone see the impact to the families. And I think our IS department really valued that the most, the enrollment leads bringing those stories from families to that table, because it kept the focus on why we were doing this for the IS team as well.
And I think we valued the IS team and how they were able to be so responsive to these suggestions. They were very open to it because they were hearing the stories and could see the the direct impact that their work was having on the clinical experience of care.
Yeah.
And I can give a quick example of where this feedback was helpful. So during the enrollment process, we heard from a family member that as she was enrolling, her child was already enrolled in the portal, and when there's a new appointment or new information on the portal, an email message is sent to say there's new information, please log into the portal. Well, these were happening through our technical system at midnight. And teenagers always have their iPhones on. Parents who have children in hospital also would keep their cell phones on at the bedside at night if they're home because they're worried, they're concerned. And so every time a new email would come in from the portal, it would wake the client up because it would beep or message, or it would wake the parent up. And just with that feedback, within 2 days, our IS team was able to make that change, and now those messages come in at 8 in the morning. So again, being responsive and being able to hear that information actually does have an impact on the clinical outcome, because we all know that sleep is so important. And we're responding to a new technology.
Yeah, and from the enrollment lead perspective, I manage a lot of the technical issues that happen. So I forgot my login or I forgot my password, and I've been hearing from families will call me and say, hey, I'm at this doctor's appointment and I'm looking for this report. Where would I find it? And I've had a few phone calls around. I really need this result and I'm looking for it. So I will help them navigate to get there. But it's very apparent that this is not a nice to have for our families. This is now quickly becoming a need to have in order for them to be able to manage their health care as efficiently as possible. So it's been really nice to actually see it. We thought about it, we dreamt about it, we knew it was going to be valuable, but to now actually see it shift into a need to have, and families calling us going, oh, I was at this appointment, I was able to pull out this health record and share it, or I was able to pull out this blood result and share it with my doctor. And it's interesting to see how they are now expecting this access and using it and wanting it. So on our end, we have to continue to ensure that this portal continually delivers the best value for our clients. So it keeps us honest on our end and keeps us driving forward with this.
So this brings us to sustainability around enrollment. We've heard that we have 2 enrollment leads who were hired onto the project as we learned how to do this, how we learned how to enroll and onboard families. But is this sustainable to really have these individuals at the clinic level responding in the model that we currently had? Are there opportunities in the system, in our current structures, to ensure that families are receiving this information, all families are receiving this information in an equitable way, that there's no randomness to this? And so we did pull together, actually just last week, a group of families to talk about sustainability. Where might they expect to enroll for the Connect to Care portal? What was their experience like when enrolling? Why did they enroll? What motivated them to do that? And what they told us was that onboarding requires more than just login information. Creating awareness of the value of the portal is key. One of our very engaged family leaders said she needed to actually have our playroom staff member talk about the portal to her, say, you know what, you're here, your kids are in the playroom, take a few more minutes, go sign up for the portal. And that's what was just that right impetus for her to go and do it, and now uses it consistently it was the example that Amir had mentioned around medication. So hearing those stories was really helpful for us to not just go ahead and make decisions on, well, we'll add it into registration. We needed to hear what was going to be meaningful. They said take advantage of any waiting times. Of course, we don't want families or clients to wait. We know that there is an inevitability to that at times. And so take advantage of those moments when waiting. And support different learning needs. Develop videos, have educational sessions, attach it to appointments. Make it work for everyone, and it may require some different strategies. Joanne talked about privacy before. These families said, you know, in some ways I feel that email is more private than my regular mail now because I get my neighbor's mail half the time, or they're developing these larger mailboxes down the road from me. And as long as I have the choice, then, you know, we may see a potential to decrease paper mail. There may be efficiencies that can be created. And, of course, we have to look strictly at the privacy legislation and ensure that it fits within our privacy impact assessment that we did do when we implemented the portal. But again, opportunities there, opportunities to decrease costs and make things more efficient and reach families where they're at. This is a new day and age with technology. They did say, please don't implement it at the clinical interface when they're meeting with clinicians. They're focused on what their questions are and what their needs are. Those are the questions that are key to them, not learning about the portal at that point in time. And again, they talked about email, you know, provide updates and new features via email. That's how they wanted to learn and hear information. We also were clear to invite families who were tech savvy and who were not. So we had a few different families, those who used email and Facebook and technology and social media frequently, and those who rarely use it, so that we were balanced in our approach, and we'll continue to gather and learn from our families as we go. Some future opportunities that we talked to our families about, they would love links to other electronic health records. Is there a way to not only have Holland Bloorview information now, but now they would be keen to have information from other locations. So it's great to hear that 67% of those of you who are watching are developing these portals, because that's what families want. They're seeing the value and the benefit, and being able to link this together would be really helpful. We chose a point in time at which, you know, we went electronic, and so families have access to that information, but they have said more historical data would be very helpful for them. And they also talked about things like having the opportunity to self-document, or even a location for client and family notes, where they could put their notes in for themselves, even just as like a notepad that they could pull up when they're in the appointment, or something that clinicians could look at in advance of the appointment. And I know there's lots of debate and discussion right now about having families co-document in the chart, or having patients co-document in the chart in a way that's meaningful and helpful, not cumbersome and overwhelming on either side. So those are some future opportunities. Lots more exists. We're certainly keen to continue this work. We're going to show you a couple of videos, brief ones now, about some experiences in care.
It's going to help me because that way I can look at everything in one place. I can look to see what happens in past appointments or more likely, and I can also see what kind of appointment it is and kind of know what's going on more, and that way I can be more independent, especially into a golf center.
I would go on to the service and check my son's appointments. He has 7 different clinics that he visits here at Holland Bloorview, and to keep track of when appointments are pending, when we have upcoming appointments, it's great to be able to just go online and see when those appointments are.
Okay, so next I'm actually going to take us out of the presentation and show you a little bit of a demonstration of Connect to Care. So you saw a little glimpse of it there in the video with Becky, but I'll go into our test environment, and we can see what Connect to Care really looks like, although I have to put the right password in. So this is the login page, and we have a link right from our website, our Holland Bloorview website, that can take people to the login page. And many of our families also will create a shortcut onto their desktop or onto their phone. It actually does look quite different on a mobile device, but it's the same sort of functionality. It actually looks really nice on a mobile device. This is the desktop view. So you can see just at the top here, this is the home page. So the client's name is at the top of the page, and the 5 sort of main buttons of Connect to Care are across the top. I'm going to talk to 4 of the 5. We don't actually use the medications tab. It's a part of Meditech that we don't use in the way that it's supported in the portal, but the other functionalities we use. You can also see at the top of the page here, there's a change person button beside the log off. So if I am a family with more than one child who has involvement with Holland Bloorview, I can have both of my children under the same account, and I could click on this and choose the other child, and it will switch over to the other child's account. So I'm just going to go back to Amy. And so we'll just kind of look first at the home page. As you can see right at the top here are external links, and these are actually web links that we've embedded within the home page. So you can see there we have some new and updates about Connect to Care. So as we add features, we'll put a link there to our website. It goes directly to our website. We have a Help Improve Connect to Care, which directs people to a place on our website where they can indicate an interest in participating in our research. And right now we have some information about getting around Toronto while the Pan Am Games are on. Again, it's a link to a website, and then there's more information about planning ahead around the anticipated traffic that was going to happen with the Pan Am Games that never really did. Upcoming appointments is the next feature on the homepage, and it would show the next 3 appointments for this particular client on the homepage, and then there's more information in the appointments tab that we'll look at in a minute. This particular client has only 1 upcoming appointment, but you can see it has the date and time and the service that they're going to see. And then below that you have recent visits, and again on the homepage it's the last 3 visits. But there is additional information, and they can actually see all of their previous visits at Holland Bloorview since we started using Meditech. So many years of appointments are in the visit history. So they can see here what appointments they had, and as Amir mentioned, this was actually not something that we were anticipating would be particularly important to families, but it was something that they really liked. They really liked having a perspective on who they'd previously seen through their journey at Holland Bloorview and all the different services, and it was really actually quite powerful for them. Also at the bottom of every page we have some information about how you can contact us for technical support. So it's directed to emails within the organization to support specific parts of Connect to Care, and they can change some preferences around. So for example, in this particular case I could change it so the other child came up first, as well as a link to our terms and conditions. So that's a little bit about the homepage. We'll next just go over to the Messages tab, and this is where people can send and receive secure two-way messages through Connect to Care. So you can see this box at the top we use just to share information with clients and families. So this is in our test environment. It's a little different in live, but we've got some information saying that we're piloting this functionality so that not all providers are currently available. And it gives you a little bit of information about how to use this particular feature, as well as some information like please don't use this for urgent messages. And a little bit about expectations, so you can expect a provider to respond within 3 business days. You can see if we go down a little bit further, this would be the message activity, and it's much like our email inboxes that we use on a daily basis. You'll see who it's from. Again, this is a test environment, so they look a little bit different than they might in a live environment. It's got a subject line that is it's just text-based, so people will enter a subject line and the date and time. And if I was wanting to send a message, I would go up to the button on the side that says Send a Message, and I can choose from the provider list. So if I was seeing one of the this would be just a list of my providers that would show up, so it would be people that I'm actually seeing. And I would choose somebody who I wanted to send a message to. I could enter a subject line and then send the message. And it would again appear in my sent messages as well. So I'm just going to not send that one and go back to the main page. I also have the ability on this page, as well as others, to print. So if I wanted to print off a message that I sent or received so that I could share it with someone else in another appointment, or just have it, a paper record of it, I can do that. So I'm just going to go back to the home page, and then we'll have a look at what we can see in the Health Record tab. So this is where obviously the clinical documentation is, and it's also where we have lab results and microbiology results, and the visit history is also under the Health Records tab. So again, the box at the top is just text that we're able to put in some information about. In it here, we note that we don't use the conditions and medications features, but other features are active. So we are able to push our allergy information from our health record to Connect to Care. This particular test client doesn't have any allergies, but they would list them there, and they can actually click on them for more information. And the buttons on the side are sort of more detailed information than you get on the home page. So the health record homepage just has those three things: allergies, conditions, and medications. But if I wanted to see, for example, some of the reports or clinical documentation, it would be under this tab here. And again, it would indicate the date of the report, the name of the report, and who had actually either dictated, or in our case it's mostly entered by the clinician. And if I want to click on one, hopefully there's a good one in here, but I can click on the actual report. And it comes up essentially as a Word document. We've included, it includes the name and the person who wrote the document, and some information with our header in it. We've also got, I'm not sure if we can see it on this view, but our printouts also include a note to say this was printed from Connect to Care, so that it indicates that the client and family are the ones printing it. And they also have the ability to download it if they wanted to save it somewhere within their own computer. So I'm just going to go back to our list of reports, and then back to the health record. And again, you can print from here as well. Under the results tab, this is where our lab and microbiology results will be. These are only obviously results that have been ordered by a clinician here at Holland Bloorview. A lot of questions, as Amir would attest, are, can I get my reports from sick kids or from another hospital or another lab? I think that's certainly where we'd like to see in the future, is people being able to see information from multiple organizations. But these results are results that are done either here locally or with our partner lab at Sunnybrook Hospital. They can get detailed information by clicking on the specific results. And for some families, they may be getting lab results for a specific test repeatedly, and then this way they can actually look at the results over time. So this isn't a particularly good example in terms of the results, but you can get a sense of it. And again, there's a print button, so they can print what they open in our system. Visit history, again, on the main page, you could see the last 3 visits, but in the visit history, it goes back to their first visit at Holland Bloorview. So for some families, there's 15 years or more of appointments,
Mm-hmm. Yeah.
And they can really see their history at Holland Bloorview. And they can click on the appointment type to get a little bit more information about who they saw. Right now, it doesn't provide information about the specific provider, and that's something that families have actually asked us if we could include. So as we look at our appointment types and how we indicate the provider, essentially a resource attached to it, we're looking at whether or not we can do that in the future. I'll go back to my visit history list. I can go back to the health record, and then I can go back to the home page. Appointments, as we mentioned in our presentation, is one of the features people are most excited about right away, even if there's not a lot of documentation for them to see because they're relatively new to the organization. They can see their appointments right away. And even for our inpatients, we do all of our appointment scheduling in Meditech. So for an inpatient, they may have 4 or 5 different appointments in a single day, and they can actually log onto the system to see who they're seeing next and where they should go. So you can see in this particular one, there's only one scheduled appointment, but there's a number of pending appointments. And as we move forward with the other functions that I talked about for requesting appointments and canceling appointments, they can actually add an appointment to their list through the request function. So if I click on request an appointment, it'll give me some information about the functionality. And then again, I can have a drop-down menu of appointments that are available to request. And there's a lot on this list because it's in our test module, and some of them are just sort of fake appointments. But in our live system right now, we only have one, and by next week we'll have 3 different appointment types. And a lot of the challenge here is around making sure people are having options available to them that they're actually able to access, so that we're really trying to make sure that the names of the appointments are really clear so that they select the right kind of appointment, and that it would be for a follow-up, so it's not something that requires a new referral that we would make available in the portal. Though we can make a lot of appointments cancelable in the system as long as we have our processes in place. But when they do select an appointment, so I'll just show you as an example, I'll pick some neuromotor OT, and then I could indicate an interest for follow-up. It actually, I can indicate my preference for a time, and we can include some of our availability. So if a clinic or service is only available certain days, we can indicate that in the appointment time. But like I can say that I'm available on Friday morning would be my preference. And they can add a comment if they like, and then they would continue. They can also indicate how they'd like us to contact them, and then they would submit their request. And then if I go back to my appointment list, that appointment will then soon show up. Actually, there it is already. It shows up on my pending list. And then organizationally, our appointment services staff would look at the request, determine if it's an appropriate request for an appointment, and follow up with the client family. So if I go back to our homepage, the only other feature that we will show you today is the profile, which is just really the demographic information that flows from our system. And it has a little bit of information about the client, their name, information, date of birth, et cetera, and the contact information. So we actually did find that within the first few weeks of launching the portal, new users tend to like to go in and have a look around. So they'll go into their profile, they'll let us know if we have a wrong phone number or a wrong address, if their status has changed in any way. So they can actually, through the portal, update their profile. It doesn't automatically change in our system, but it creates essentially a request, and our health data records people will then look at the request and make the appropriate updates in our system.
And that was something we learned in the Family Advisory Committee. One of our family members actually went and changed some of the information, but then we weren't clear that it would take a couple of days to make the change, so that they didn't understand why they weren't seeing the change and thinking the system was broken, so helped us with some of the language that we put up on top to make it a bit more clear for our families.
Okay, so that's a little bit of an overview of what's available in Connect to Care. Do you want to add anything, Amir, about specific features or functions?
No, I think you did a great job. I think with the appointments and health records, once Joanne showed you that she was scheduling an appointment and it was showing us pending. Once that appointment does get scheduled, there's an automatic email that gets shot out to them saying you have a new activity in the portal. When there's a new health record that's been uploaded, there's an email that sends us that you have a new activity in the portal. It doesn't identify the activity just for privacy purposes, but they get an immediate email to let them know that there's something in the portal for them to go see. Which has been really helpful because families are like, yeah, I just made that appointment upstairs and I was walking out the building and I got the email from Connect to Care saying there's a new activity. So they don't have to wait for that letter or the phone call. They can see it immediately, and we're notifying them that something's been scheduled. With the appointments as well, I remember enrolling one dad, and he looked at his appointment schedule, and this was on a Tuesday I was enrolling him. And he looked at his appointment schedule and said, I didn't realize I had an appointment on Friday. And he was telling me how it's an hour and a half travel time for him, and how he has to be at the bus stop at 9 o'clock with his son ready to go, so they wake up really early. And he said now he could see his pending appointments and all the appointments that potentially are scheduled for him, and try to schedule it within one day. So he can take charge of what's coming up and say, I'm going to dedicate this day, I'm going to take this day off of work, and I'm going to try to get through all my 3 appointments, because he's now able to see everything in the portal.
Mm-hmm. I'd just like to add, too, just as another piece of information that might be helpful for the audience is obviously our Connect to Care portal is an English language portal, and our documentation is in English. But we do have a lot of clients and families who are not English as a first language. And many of our clinicians, as we were looking to move forward with the portal, and a lot of our families did ask, is there opportunities to look at providing information in different languages? And really interestingly, obviously it would be lovely to be able to offer information in different languages, but our experience as people have been enrolling is that many families who are English as a second language are really appreciative of the opportunity to have more information accessible to them at home. It gives them opportunity to perhaps work with a family member who has more knowledge of English. It allows them to have that printed record that they can take. They can download it into their system and then use one of the many language translator apps to try to get a little bit more information. And Amir told a story about one woman who actually cried when she saw that she could see information through Connect to Care and have the information available for her to talk to other family members who had a better ability to read and in English.
And that's a good point, because a lot of these families who don't speak English as well have a hard time with those discussions with their clinicians, with their teachers, with their principals, and now having that report, they can just take it and say, here's what I'm trying to explain to you, or read this, and then try to have a better discussion. So I've heard from quite a few families about how just having that report, to be able to hand it to somebody else, because they can't explain that appointment. And we've all been at appointments where we walk out after an hour and only remember the last 3 minutes of the discussion, or we forgot to ask a question. The portal really addresses a lot of that. We can go home and especially from a lived experience, I like to do my reading after everyone's gone to bed. So it gives me the opportunity to be able to look at the records at my time when I want, and to be able to have a more informed and educated discussion with my healthcare providers. So that's been a value for a lot of our families, that accessible at any time. And like I said, a lot of times they walk out and they say, I forgot to ask that question to the doctor. Well, now they can ask that question to their healthcare provider. So it's been really amazing to watch how this has evolved into a need to have for our families, and how much it's been helpful for them.
Okay, so that concludes our formal presentation, and now we're going to open it up to everyone if there's any questions that we might be able to answer.
All right. Yeah, we do have quite a few questions lined up, so great presentation. Really gives us a good example of some of the functionality there and the impact on the families. It was really a great presentation. The first few questions came in from some of the technophiles in the audience that really wanted a little bit more information on some of the back-end technology. So there's 2 or 3 questions. I'll sort of read all 3, and maybe it'll give you an opportunity to answer them sort of all at once. People were asking, what e-health solution / software do you use? Is Connect to Care standalone, or does it integrate with your existing system? And a few other questions asking about the difference between your electronic patient record or the health record and Connect to Care. Is it the same system? Is it integrated? Is it sort of that kind of a question. And the third question in this line was, you mentioned that Meditech was chosen also with its ability to integrate with the existing system. Can you elaborate on your existing system that you expected integration with, and why Meditech was chosen? So just sort of some background on the sort of the brand of technologies that you're using, both for to build Connect to Care and to integrate, and what you had to integrate with in your existing system.
Absolutely, and sorry, I thought we tried to sort of reflect that, but I probably wasn't particularly clear. And you don't have three technophiles as presenters here. Our health information system is Meditech, and it has been for many years. So I think Holland Bloorview has had Meditech systems in place since the 1980s. We've had different modules of Meditech for a long time, and we've had clinicians documenting into the system, like day-to-day documentation. We've had an electronic health record across the whole hospital since 2012, and our inpatients were actually 3 or 4 years prior to that. So we do have a lot of information in our Meditech system. And we did look at other solutions that were not Meditech in terms of a portal, but it's obviously a lot more challenging to work with interfaces in integration when it's not the same provider. So Meditech does have a patient portal product. It's essentially another module of our Meditech system. And we were able to, after an RFP process and review and careful consideration, that's the product we chose. So it is the same vendor. It's Meditech, and that made it much easier from a timing perspective to be able to move forward with with Connect to Care. So just to give you a sense of the timing, we did our RFP in May and had our proposals back in June. We were doing reviews and interviews through the summer months, and we chose to go with Meditech in August. And by the first week of October, we actually had the software on site here in our building, and we're able to begin our testing process. And so, and I can't say enough about how much our information systems team does with respect to testing. They've tested every potential possibility of every potential occurrence for the next 2.5 months so that we were ready to go live with our Family Advisory Committee the first week of December, just as that snowstorm hit. So if we had chosen another solution, our timelines may have had to change in order to have the solution in place and ensure all the privacy and security measures were addressed. It was probably much easier for us to go through our privacy impact and risk assessment processes, given that we were using an integrated solution.
We also found that solution really kind of checked the boxes on the things that families and clients were asking for. There were fancier systems for sure, but we wanted to make sure that we were meeting the needs as identified by our clients and families, and then having the option for this integrated solution was really helpful. It was one of the tightest timelines, I worked on in a tech project for sure, and we were all kind of going on blind faith, and everyone really digged in to make sure that this would happen in the timelines that were set out.
Yeah, one of the things we heard loud and clear from the families was the portal needed to be simple in its usability and very, very clear and easy to navigate, because we want to make sure that everybody could use it, no matter what their technology background or professionalism is. So that played a big factor for us as well too, because when we look at this portal, there's really 5 tabs that you have to navigate, and we felt that this was a really simple solution, as well as the families that were on the RFP identified that as this as one of the simpler solutions. So that was a big decision making factor for us as well.
Mm-hmm. I think as what we certainly found too is this is relatively new in the healthcare space in Canada to be looking at implementation of consumer portals. So there's not a huge number of products available that are well developed. So there's a lot of really interesting information from vendors around products that they were working on or looking to pilot in different environments, and a lot of really fascinating features that you could see us building towards in the future. A lot around what Laura talked about around how clients and families can actually integrate information, how it can pull information from things like Fitbits and personal technologies. I think the future is really fantastic. and hopefully there's greater interoperability and opportunities to link systems as we move forward. What we really ended up choosing was something fairly simple in order to make our timelines, but also because fairly simple seemed to make, it seemed to, as Laura said, check the boxes in terms of what we really needed to deliver, both for our Canada Health Infoway partnership, but also because that's what our families wanted.
And I've heard since we started enrolling families, we've heard they're using it because it is simple, that it's not a complicated system. So once they get that email about there's a new appointment, they click on it. It takes them right to where they need to be, and the 5 buttons make it easy for them. So I think that drives some of the usage as well.
All right, we had a question. Next question came in from Julia, who says that a family portal is in their future. She's got a few questions sort of embedded in here. She was wondering, how do you manage the user accounts? And I think she means sort of from an onboarding perspective. And when do you close off their accounts? And perhaps under what circumstances? So is it after a certain amount of time, or are there other circumstances in which you would close off their accounts?
Right. I remember actually before we went live with our system, we had some really intense discussions around deactivation of accounts. That is certainly something we're looking at, not just for our consumer health portal, but even for our electronic health records. We have a lot of information for clients who, because we're pediatric, age out of our system. And a question comes up around at what point in time, after how many months of inactivity, et cetera, do you deactivate the account? With respect to a consumer health portal, particularly again for a population like ours, we have chosen not to deactivate based on time or inactivity, because a person could need that information in 3 or 4 years when they're accessing adult services, and really benefit from being able to re-access a note from their pediatric care provider. So we're not doing it based on age. We do have a sort of a policy that we've developed around when you might deactivate based on a lot of the issues around deactivation actually come from custody and access. And so if ever a child who had capacity asked us to deactivate their parent or caregiver's access to their record, then that might be an indication for deactivation. If ever custody rights changed, then you would have to look at deactivation of a record if a parent who no longer had access rights or access to information rights had a portal account. So we need to have things like that in place, but we don't deactivate records based on time or inactivity.
All right. Julia goes on to ask, how many people manage the training, passwords, support, et cetera, to the 600 users? So how many people are behind the scenes working on this?
Amir can answer that one.
From a login and password reset, there's myself and Becky Quinlan. So we're dedicated to the enrollment process, and as well as all the technical issues that come along with the login and password resets. I would say right now our technical calls are increasing to probably, let's say, an average of 2 a day. But a lot of that has to do with the fact that they're enrolling in the waiting rooms, and then they get home and they forget that login and password. But it's also a really good indicator that people want to use it, right? So it's not taking a ton of our time in terms of technical issues that come through, and we're not getting a lot of other technical issues that come through it. The only real once they're in, there's not a lot of technical stuff that can happen. There could be some questions around what was said in a report, and that contact us button, once they put it in there, it'll direct it to the appropriate people. So health data records would get something like that. Part of our education is also, if there's something missing in your report or something doesn't seem right, talk to your doctor about it. If your allergies have changed, talk to your doctor about it. So that's part of the education to sort of get rid of some of those calls, and they know who they need to go to if something is missing or not looking correct.
And just to clarify, Becky and Amir are each half-time on this project,
Yeah,
so it's the equivalent
right.
of having one FTE, one full-time person doing the registration. That being said, we're also looking to sustainability and what that might look like in the future. And we haven't yet arrived at that solution, but we're looking at methods of integrating into some of our current activities, knowing that there's probably going to be some kind of a need going forward to have somebody still have some accountability for this piece of it.
Yeah, I kind of want to, maybe not part of the question, but one of the things that that we've noticed through the enrollment process is it takes time. There are families who are not used to this kind of technology, are a little bit scared about this technology, not sure how this technology would help them or how it relates to them specifically. And Becky and myself actually spend the time. And so, okay, so here's how I think you'd use it given how many appointments you have. Or I've heard families say, well, this is my last appointment here. Then it's a sit-down discussion about how they could potentially use it as they transition into adulthood. I've heard some families say, well, this is my first appointment. Well, this is a great time to actually get onto the portal because you will have record right from the beginning, and as you start your journey and start talking to other clinicians, you'll have to go to see a principal or teacher. All this excuse me, that was a hard word for me to say. It was already ready for you. So spending some time educating the families about the use of the portal and how it's going to benefit them has been a real success for us in terms of families saying, okay, let's do it. And then once they're on it, you don't have to sell them again, or you don't have to educate them. They're actually coming back to us saying, we want more, we want more. So it does take some time up front.
All right. We did have another question sort of related to that last question. Sonia asked if you're able to update demographics through the portal, like if the patients are, and you sort of showed that you can, but it's not an automated process. So you send in your update, and someone on the other end has to deal with that request and actually do the inputting of the information. Just to sort of go back to the previous question about how many people are sort of behind the scenes working on that, that's not an additional person sort of related to the Connected Care program. That's someone in the health records department that would just receive that request to update the demographics and do the work of inputting it?
Exactly. So any changes through that profile update go to our health records department staff, and they will look at the request. They'll make sure that the person understood the fields correctly. Sometimes people mistake the client box for their information and change the marital status of the child. So they look at just to make sure that the information is accurate. Sometimes they'll follow up with the person by phone to make sure that they've understood the change request. And then if the changes are appropriate, they'll make the changes in the system, and then it would be reflected in our health record.
And sort of similarly with scheduling of the appointments, again, not someone within Connected Care, really the same people who would be dealing with scheduling of appointments by telephone or otherwise are just receiving these requests through Connected Care and are just trained to respond through Connected Care?
Exactly, and I can say as of this morning, I think we'd had very few requests. 11 or 12 people had used that contact button around appointments. But really, that's what we're looking at it as, is another way that people can contact us. The processes aren't really different than if they called us or came to speak to us in person at a registration desk. It's just another way for clients and families to give us information. So the information comes to an appointment service. It goes to a special appointment services mailbox, and they would address it like they would a phone call.
I could also, just to add to, for this project to get off the ground, we've had Joanne as a primary project lead, and that's been integral to the success. So ensuring that someone is leading this process in a really thoughtful, project managed way has been key. So, going forward, we may not need that, but there's still going to be some accountabilities, but having someone who's going to really take that leadership and ownership, full stop, has been absolutely critical.
Dale was asking if families can add information into the health record, so we sort of addressed the demographic piece and changes there. You mentioned the notes and having a family or client's notes section, which I believe you said you haven't activated yet. Is there any other sections of the record where the family can input data?
So not at this point. It's something that definitely came up in our early focus groups and even in the focus group that Laura and I did just last week, is that not necessarily that families always want to have input to the record, but that it would be nice within the same space for them to have an opportunity to indicate some of their notes or questions or comments, more for their own ability to remember something in an appointment, for example. There are others who would like the opportunity to actually input into the health record. Our portal solution doesn't have that functionality at this point in time. I could see it being something that is developed over time with our portal as well as many other solutions, but it's not something that we can offer right now.
Mm-hmm. So someone like that may have diabetes that is regularly checking their sugar, they can't put in those results themselves.
No, so we were talking to one of our families last week, was noting that he uses like an Evernote functionality in his iPad or his mobile phone to write notes like that around his daughter's care. And wouldn't it be nice if it was sort of somewhere in Connect to Care? But it's not something that we can offer right now. It's one of those great future opportunities.
Yeah, always lots of opportunities for the future, yeah. Margaret was asking, when you were demonstrating the ability to send messages to the care providers, is there the option to include more than one person in the message, like a CC or multiple recipients?
And that question came up a lot too. It's interesting how people think the same way. No, we're not able to include two providers on the same message, and I think a lot of the rationale for that in the development was that they wanted to be very clear who is going to respond to the message. So it might be that someone will share it with another provider, and you can use sort of a cover feature if there is a nurse working with a physician in a clinic, that they can both access the same account, but a message would go to one single provider.
All right. We've got about 2 minutes left in our scheduled time here, so we've got about 3 or 4 more questions left, so we'll sort of try and not rush through them, but so we can address them all, but just to keep an eye on the time. Margaret's asking, is it possible for healthcare providers to have access to the patient's chart or the messaging system if they're not part of Holland Bloorview? So I'm assuming she's referring to maybe a private, someone that's providing some sort of private-based service, or someone in a school system that might be providing some sort of service that's related to care that they're receiving at Bloorview. Is there any way to connect them outside of, if they're not sort of within Holland Bloorview?
So I would say yes and no. So in the way that we're using Connect to Care, no. So we're really limiting enrollment to clients and their immediate family. However, the functionality is there, and some of the hospitals in the United States that are using portals will allow, say, a family physician to enroll in someone's portal to access information. We're really considering this to be our client and family portal. So we're leaving the control in the hands of our clients and families, and they can share information as they would like to do. But we're not, at this point, considering enrolling people who are not clients and families at Holland Bloorview.
Mm-hmm. So from a sort of a privacy perspective, so one of the options that you demonstrated was the ability to print off information that's there, which could be private health information, test results, and that sort of thing. So the family printing off that information, sharing it with someone, and that information, that potentially puts that makes that a privacy risk, and that gets passed on or left in a chair in a waiting room or whatever. Was that part of the discussion, like allowing that ability to print those kinds of results?
Absolutely, and I would say that it's in our terms and conditions. There's language around if you print something off from Connect to Care, you're taking responsibility for looking after that information. So use your own home printer and be careful about how or where you leave the information. But it is also something that our clients and families really wanted to be able to do, because they want to be able to print off that report and share it with the teacher, or share it with the physiotherapist in the community, or share it with the principal at a new school. So I think it's an important function to have, but it is putting some responsibility into the user's hands with respect to taking care of that information. So it's partly why when they print something off, it says printed from Connect to Care at the top, because we want to be clear that it's not Holland Bloorview staff that are printing off the information and potentially leaving it somewhere they shouldn't. It's the client families are taking the responsibility for for that information and for the keeping of that information once it's printed.
Yeah, it's interesting. We had a session last week with a couple of presenters, Dr. Ann Kavukian, who's the former Privacy Commissioner of Ontario, talking about privacy, managing privacy in healthcare and some other issues. And part of the conversation was around the old attitude of the healthcare system, and maybe old in some centers, maybe still exists in some centers, where there's the attitude of trying to protect the patients and families from themselves, right? They don't understand the implications of this information getting out, so it's best not to give them access to it at all, versus your approach of really, families are partners, they are responsible enough to deal with their own information. It is their information, and they just need to understand the implications and then let them do with it as they feel they need. I think it's an interesting shift in philosophies over the last few years.
Yeah, I would agree. But at the same time, we mail out lots of paper copies of reports, and we are not so concerned with that paper copy being left, being taken, being copied. So I think, again, it's a different way of accessing the information and a different way of allowing them to share it, but it's putting the control in the hands of the person who the information is really about.
Yeah.
We heard from families about this sort of report and how stuff gets mailed right now. And at one of the meetings, one of our families was telling us how they just received their neighbor's financial records. And he could pretty much go in and tell them how much money was in their bank and stuff. So he felt, having it in the portal and being able to print it that way was more secure than the old mail way. And we've also heard there's a bit more concern around privacy from the organizations than there is from families. Families just want access to it. We obviously have to do our due diligence to make sure that we're taking care of it, but our families don't seem to be as worried about that as we are. As well as we should be.
Yeah. And the last question here is from Margaret. She's asking if you had any focus groups with healthcare professionals who had concerns from a workflow perspective around duplication of messages that might appear in the Connected Care system with duplicate messages that they may have received from other sources in their regular email, et cetera, and how they're managing that sort of workflow around messages and information potentially being in two different places.
So definitely clinicians are a key stakeholder group, a big group too, and so they are involved at our change team level, and we do also have been to practice councils across the organization many times. So really what we're looking at with the two-way messaging, and I can say that so far the volume has been quite low, is that it's a different way of having families get in touch with us, but it's usually not an additional way. So if they were previously leaving you a voicemail, they may now use two-way messaging. And for families, it's certainly much more convenient. And for some of our clinicians, they're also finding it much more convenient and clear. And they have a record of it in the desktop where the messages sit. There is, right now, the way it's structured, a little bit of, they do document the message in their clinical notes, but we're working with Meditech around is hoping that they'll eventually flow those messages directly into our EMR so that we can reduce that part of the duplication. Mm-hmm. There is some sort of, for sure, from some of the clinical groups, some hesitation around the two-way messaging. More, I think, a fear that all of a sudden they'll get lots and lots of messages, and maybe some of them won't be sort of appropriate messages, maybe something they can't answer, a client they don't see anymore, something like that. But there's a lot of functionality that we can restrict who they're messaging, so it's active people that they're treating that are able to message them. And we have guidelines both for our clinicians as well as for clients and families around how to use the messaging functionality.
Yeah, we've heard a little bit about how it's reducing some of the telephone tag.
Yeah.
From the appointment services as well as from the email, that some of that back and forth of chasing. We can't really leave anything on the voicemails, so it's reducing some of that time in terms of the back and forth with the phone calls.
All right. Well, I think it's time to pack up. We've got lots of comments about both the great presentation and fantastic tool, wonderful tool. A lot of thank yous coming in from the audience. So I think people do have to. We are over our time, so I think people are starting to have to go back to their actual jobs. So I'll just hand it over to you one last time for any closing comments. Anything you'd like to close this off with before we wrap up.
So I guess just that this has been a really exciting opportunity for us. We've learned throughout this process, and now see the huge benefit. Well, we've always seen the benefit, but now we have experienced the benefit walking side by side with our clients and families on this wonderful tool. And, you know, I'm excited to see where technology goes into really placing healthcare in the hands of young people and their families as they try to, you know, navigate what can be a very complex healthcare system.
Mm-hmm. I think we're just at the beginning. We're only just learning as an organization, as clinicians, as families, how to best use Connect to Care to support activation in care, to really support that partnership and to improve outcomes. And I think there's huge opportunities for using tools like this to really partner with our clients and families to share information more effectively, to communicate more effectively. And I think we're just starting to see the advantages of that. It's been a really great project to work on, and the partnership across all areas of our hospital has been fantastic.
And I guess finally, if anyone wants to talk more about this or have ideas for us, that they've seen opportunities for us to even make improvements or things that have been done or being looked at in the sector, we love to hear those ideas and love to talk with others about this work. So please be in touch.
All right. And we'll be sure to share your contact information through the Knowledge Exchange Network. And if anyone contacts us, we'll certainly pass them along to you to continue that conversation. All right. Well, thanks again for a great presentation, and thank you to the audience for joining us. Your questions, as you can see, really enrich the discussion and really the sharing of information from across the country and all the different contexts that we're all coming from. I think it was the conversation was really beneficial for everyone. We do our webinars every Wednesday at 11 a.m. Eastern Time, and it's always great when you can watch live and participate, but if you can't, we do record these sessions and make them available after the fact on the Knowledge Exchange Network at ken.cafc.org, so you can always go there and check out the recording if you did have to leave early, or if you want to share it with your colleagues, by all means, please do check it out there. Next week, we've got a great session called Challenges in Remote Air Medical Transport, and this topic comes to us from CAFC's Interfacility Transport Committee, where we'll hear from one of our steering committee members, Penny Triggs, formerly of Keewatin Air, along with some of her friends and colleagues that she's gathered over the years, Cara Levy, Dr. Sandy McDonald, and Sheila Thompson, who come to us from Nunavut, Northwest Territories, and Yukon to talk about the challenges and bring some great information and what will really be some really interesting stories about providing services in the remote north. And one of the things that they're going to be sharing with us is how each of the territories has its own unique challenges. The north is not the north, they tell us. They're all three of the regions are very, very different. So we hope you can join us next week, and then we'll be off for actually 2 weeks. We have a bit of vacations and that sort of thing to deal with in the CAFC office here, and then we'll be coming back closer to September to continue on with our webinar presentation. So thanks for joining us today, and we hope to see you back here next week. Bye, everyone.
Bye-bye.